No one wants to get COVID-19. And if we do get it, we don't want to end up on a ventilator with a slim chance of survival. But what can we do? Masks, hand washing, social distancing, of course. Avoid crowds, sure. But what if we just get it anyway? Is there any way we can protect our immune system so we're more likely to recover? Yes, there is. Improving your general health can greatly improve your chances. So this is a perfect time to work on your health while you lower your risk factors for COVID-19. As a certified health coach and exercise physiologist, I felt like I had to share some recent COVID-19 research with you. It's both alarming and encouraging. The majority of people recover from COVID in a few weeks, but a recent report from the Mayo Clinic outlines long-term health effects of COVID-19. The most common include headaches, lingering fatigue, problems breathing, and joint pain. But COVID is a nasty virus and can cause long-term damage to the heart, lungs, and brain, putting you more at risk for heart failure, strokes, respiratory problems, Parkinson's disease, and Alzheimer's. Some experience blood clots, blood vessel problems, liver and kidney issues. Your mood can be affected in a similar way to PTSD. Even young, fit people have had some of these after effects. However, people with underlying conditions are more likely to experience the more severe issues. According to the CDC, people with underlying health conditions are 6 times more likely to be hospitalized and 12 times more likely to die. Poor metabolic health is directly linked to severe outcomes. And according to the University of North Carolina research, only 1 in 8 Americans have proper metabolic health. High blood pressure, excess belly fat, high blood sugar, high triglycerides, and low HDL are the main risk factors. If you have any 3 or more of these, you have a condition called metabolic syndrome. You can see how these health issues interact with each other to make your condition worse, and they all have an effect on your ability to recover from COVID. The top 3 that affect COVID outcomes are obesity, type 2 diabetes, and high blood pressure. Patients hospitalized with COVID-19 who have a combination of obesity, high blood pressure, and diabetes were 5 times more likely to be admitted to the ICU and over 3 times more likely to die. This was according to a new study at Tulane Medical Center. There are a number of reasons for this. One big one is that metabolic syndrome messes up your immune system big time. 60% of Americans are overweight or obese, according to research from Columbia University. Having a waist more than 40 inches in men and 35 inches in women encourages inflammation and blood clotting. These are 2 of the problems associated with severe COVID-19 cases. Also, doctors have found that hospitalized COVID patients do better lying face down. Excess belly fat prevents the diaphragm from working properly, making it harder for the patient to breathe in that position. Losing that belly fat and maintaining a healthy weight can virtually eliminate this problem, according to a British public health report. A healthy diet you can actually live with, and getting on an exercise program will help you meet this goal. Over 100 million people in the U.S. are living with high blood sugar. People with diabetes generally experience more severe COVID symptoms, complications, and are more likely to be admitted to the ICU. However, the American Diabetes Association says well-controlled diabetes reduces risk of severe outcomes. Blood sugar can be regulated with a low-carb diet, exercise, maintaining a healthy weight, and meds as needed. If your blood pressure is greater than 130/85, you have hypertension. Nearly half of Americans have high blood pressure, and only 25% of us have it under control. Uncontrolled high blood pressure can put more strain on your heart during COVID, and it weakens the immune system and makes it harder to recover from the virus. A study at the Sharp Medical Center in Chula Vista, California, suggests that COVID infects the cells that help regulate blood pressure, and that there may be a link between hypertension and severe COVID infection. So it's important to keep your blood pressure under control with a low sodium diet, regular exercise, reducing your stress, and meds if necessary. I'm sure you see a pattern here. Metabolic syndrome can often be managed with lifestyle changes. Easier said than done? Yep, but it is doable. And it does not have to feel like getting your teeth drilled. The hardest part is getting started. Once you define your goals and figure out a method of reaching them, and you are mentally ready, you can make living healthy a part of your life.